We conducted a trial looking at the use of abemaciclib in patients who have breast cancer with brain metastases. There were two breast cancer cohorts on the study. One was for patients who had hormone receptor positive, HER2 positive tumors, and the other was patients who had hormone receptor positive, HER2 negative tumors. And we're just reporting the results for those patients who are hormone receptor positive and HER2 negative. This is an interim analysis of that cohort, and so we're reporting data for the first 23 patients that were enrolled. And what we found was that there were two patients who experienced partial responses within the CNS, suggesting that there is activity of the agent in the brain in patients who have hormone receptor positive disease. I do think it is interesting, though, because we had previously presented work looking at CNS penetration of the drug itself. So one of the other cohorts on the trial that, again, has been previously reported was a surgical window cohort. So patients got upfront abemaciclib and then went to surgery for resection of their brain metastasis. And in that study, we did look at levels of the drug within the tumor itself and also within the CSF and compared that to drug levels in the plasma. And you can see that they're all comparable, suggesting that the drug is really getting into the tumor itself and into the CSF well, which I think is comforting to know. And then now seeing the clinical responses in the brain is sort of confirming that not only does it get there, but it actually does have activity, which is reassuring.